Welcome to EAU Podcast. In this episode, we are joined by Dr. Nazim Gherabi. He talks about his study, Treatment of Urge Incontinence in Postmenopausal Women, a systematic review. Join us as we embark on this informative journey.
I am Dr. Nazim Gherabi. I am a urologic surgeon, and I work in Algeria.
Dr. Gherabi, please, could you summarize your study?
In this systematic review and meta-analysis, we tried to focus on these patients and to look for the different treatment strategies, to compare between the treatment options, because especially for postmenopausal women, we have the so-called genitourinary syndrome, postmenopausal syndrome, characterized with a lot of physical changes in the hormonal status, in the vulva, in the vagina, in the lower urinary tract, and that make the diagnosis and the treatment more difficult in those postmenopausal women. So our study is a meta-analysis, and we look for the literature for up to 2024, and out of 248 record, we choose 35 eligible RCTs for the meta-analysis, and we compared the different treatments available, the different treatment option. It was mainly about estrogens, anticholinergics, and the pelvic floor muscle trainings. Those were the most studied treatment in these patients.
What are the main causes of OAB in these patients, and how do you manage diagnosis and treatment in your clinical practice?
The diagnosis of overactive bladder or urge incontinence in postmenopausal women is well known. We have, of course, a complete medical history, physical examination, and in nearly all cases, no imaging or urodynamics is needed at a first line. In our study, we respected those guidelines for diagnosis, and our major finding in our studies, the major result were that compared with placebo, the systemic estrogens were associated with a decreased odds of improving urinary incontinence in postmenopausal women. Then, no significant improvement in urinary symptoms were observed in patients treated with local estrogens, although they showed to be helpful in vaginal symptoms improvement. Another finding, another side of our result, we looked at the other treatment options like vitamin D, phytoestrogens, and estrogens modulator that are used in some studies. And we found that they were not effective in improving those symptoms of urge incontinence in the postmenopausal woman. And only one RCT in the 35 eligible selected RCTs demonstrated that the oxybutynin was significantly better than the placebo at improving postmenopausal urge incontinence. The anticholinergics plus local estrogens are not more effective than anticholinergic alone. And finally, we looked at the physical therapy, which is an interesting treatment option, an interesting treatment strategy. This physical therapy for those patients showed an overall positive outcome on postmenopausal urge incontinence symptoms.
How does hormonal status affect urinary incontinence, and does it change your assessment?
Because of the genitourinary syndrome of menopause, we have some physical change in the postmenopausal woman. We have a hormonal change as well as physical change in vulva and vagina and the lower urinary tract. So in this situation, in our practice, we usually refer the patient to the gynecologist before to start our treatment, before to start our therapy. And gynecologic assessment, of course, will include and provide the result of the cervicovaginal smear, which is an important issue, especially if we are planning to give an hormonal therapy, whether it's local estrogens or systemic estrogens. In our studies, we mainly focused on urge incontinence. Of course, we can have mixed incontinence. We can have a lot of symptoms in the same times, but we focus on the main symptom, on the major issue. If this major symptom is about urge incontinence, we continue so on.
Considering the side effects of OAB treatments, particularly hormonal therapy and anticholinergics, how do you address this with your patients? How do you manage hormonal therapy in patients with history of breast cancer?
In this situation, we discuss carefully this hormonal therapy with the gynecologist and, of course, with the patient, and especially in the patient with a history of breast cancer or a breast cancer treatment. We have to, in first side, provide explanation of the side effect of the anticholinergic, which is the most commonly used therapy. And then we talk about the hormonal therapy, the estrogen possible impact for these women. And if there is any contraindication, we change our treatment strategy. And that's the importance of our study, where we take a look at all the possibilities, at all the treatment strategies if we are in such a case. If we can't use hormonal treatment, for example, no estrogen, if estrogen is contraindicated in any patient, we have other possible therapies, and our meta-analysis show that we need more data for those other options.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on urological advancements, be sure to subscribe to our EAU podcast channel on your favorite podcast app. Until next time, keep learning and stay inspired.